Mike. Okay. Hi, everyone. Welcome to the Finance and Revenue Committee. Hope you all had a good Labor Day and got some rest and did not labor. So we'll start with roll call.
We'll get started in just a second.
Oh, okay.
So
Not everybody's
make sure everybody has permissions and is ready
right.
to go. Okay. Thank you for your patience. Starting the roll call, Cheryl Ramirez.
Here.
Thank you. Chen Wei Chi is not available. Mary Lou Heinrich.
Henrich, and I'm here.
Henrich, thank you. And yes, please correct any mispronunciations. Thank you. Richard Gibson.
Here.
Thank you. Jeff Goodman.
Here.
Thank you. John Santa.
Here.
Thank you. Bethany Stairs. I don't see Bethany yet. And Charlie Swanson.
Here.
Thank you. That's everyone.
Thanks, Isabel. I don't know if there are any announcements or not. So we can go over the agenda unless, Mimi, are there any announcements that you know of? I didn't remember to ask you. I guess what I could say is I know that John wants to talk about something, a discussion that the governing board had in August. So we're going to do that during the previous meeting follow-up board and committee updates time, which is right after this, right after the agenda review. So could we move to the agenda? Oh, it looks like we're introducing the Milliman team. Are they here?
Not yet, and it looks like
Okay.
Director McDonald is having some tech issues, so she's
Well,
gonna log off and log back on.
Okay. Well, we'll hold off until she's back and they're here. The team is here. So today, again, Mimi will go through the previous meeting follow-up, board and committee updates, and then really Echo Northwest has the bulk of the agenda. They're going to kind of help us summarize where we are with revenue option refinements, impact of revenue on individuals and businesses, and then I know that Mimi has drafted a straw proposal for the revenue, so we'll probably go over that. And then kind of summarize and go into next meeting topics. I believe we have 3 public comments today, so we'll start that at 11:45. And that's all I've got. Is Mimi back on?
Not quite yet.
Oh, okay.
And this is Mary Lou. I'm sorry, but for some reason my computer is saying that I don't have Zoom installed, or I don't know something. So I'm on my phone at the moment, which is not my favorite thing. So I'll try to figure that out later, maybe during the break. I don't know. But if can you hear me, see me?
Yeah, I can see you, hear you. Mary Lou, were you trying to use your iPad?
No, no, I hate that thing.
Yeah, I tried to join the board meeting with my iPad and I did not have good results. I was just curious.
No, this was my laptop that I do everything on and have tons of Zoom meetings and everything. But this morning, of course, when I about 10 minutes ago tried to do it, it said, you are no longer has Zoom something or other. And so then it tried the app. Well, I did that and it, so, but my phone's working. So that's good to just hear that.
Yeah, can see perfectly and hear you.
All right.
Fine.
Marvelous. Technology is so great.
Yeah, I hear you.
Right on cue, it sounds like Mimi is back now.
Okay,
So
great. Well, I'll hand it over to Mimi then.
I am here. Apologies, everyone. I'm going to stay off camera. Let's see. Isabel, can you go to the next slide? Thank you. Thanks, everyone. So at this point, we're just going to talk a little bit about follow-up from our prior Finance and Revenue Committee meeting. So at the end of the meeting, a couple of things were brought up to bring before the board. And these were the questions that came from the Finance and Revenue Committee. These are kind of summarized, which essentially was the Finance and Revenue Committee wanted to make sure that, or wanted to ask, should the funding approach continue to pursue a single payer model, consistent with the Joint Task Force recommendations, or in addition to that, should it pursue that model, but also should the focus shift to include an analysis of a revenue plan that doesn't provide coverage for all of those populations? For example, does the board recommend that Finance and Revenue Committee, in addition, look at something that perhaps does not cover those eligible for Medicare? And the answer from the from the board was yes. The board would very much like the Finance and Revenue Committee to look at all of those options. And it's similar to the second point, which was that in addition to the current evaluation of PEB and benefits, should the board consider, or would the board recommend that Finance and Revenue consider some options that have limited, perhaps slightly more limited benefits? And again, the answer was yes. So in other words, the board very much is in sync with what Finance and Revenue Committee is looking at. And so considering or encouraging Finance and Revenue to continue the work of what the Joint Task Force recommendations were, but also to look at other options. And then John Santa, I see your hand up, so you're definitely going to be called on after this. Plan design and revenue. I just wanted to make a point. I think Jeff Goodman brought up the point. He thought that perhaps the Plan Design and Revenue Committee had not heard about recommendations of PEB and OEB, and I just wanted to go back. Sometimes it's obviously not everything is brought up in every committee meeting, but the Finance and Revenue Committee, or excuse me, Plan Design and Revenue, looked very much, if you go back to the January 9th meeting, that's when they did a big review of benefits, and they looked at PEB level benefits. And so that's just in the meeting notes if you're interested in it. And that was the recommendation that they gave at that time, that the board and the Plan Design and Revenue would recommend looking at benefits at PEB level, and also for those Medicaid eligible people at PEB plus, so the additional benefits. And so next, I know John Santa had sent an email saying he was interested in bringing up something from the board meeting. So John, I'll let you take it away, just if you have a pretty packed agenda. So if you hit the highlights, that'd be great.
Well, Mimi, I'm sorry, but this is going to pack it more because I have some very serious process concerns. And this slide, you've made it easier for me, captures that. I don't know how many members of the committee, and I specifically now want to focus, I'm talking to members of the committee, not staff, not consultants here. When I watched the board meeting, albeit last night, and I was very impressed with Morgan's presentation and impressed with the level of discussion by board members until the end, when one of Morgan's last slides basically framed the first bullet on this slide, as Mimi's comments have framed it this morning, as having come from the committee. Colleagues, read that first bullet. Chair Ramirez, where is the documentation that the language in that first bullet came from this committee? I've missed some meetings, but I've listened to all the recordings. You all know how interested I've been in Medicare. And it was stunning for me to see this bullet be presented to the board as if it came from us. That's a serious process concern, and it needs to be addressed. Now, there's no question in my mind that this is obviously coming from somewhere. So I'm asking this morning, if not now, who is this coming from? Did this come from another group of board members who had an off, meeting conversation? Was there some email discussion about this language appearing and being presented as if it came from us? We don't get minutes. We don't vote. And I've just had it with this process. So we can talk about the content of this, which obviously I'm appalled at for a variety of reasons. This is an issue that I thought would have been sorted out by the board at one of their first meetings, but clearly it hasn't. Somebody somewhere thinks that we should be spending time and very significant resources on an analysis of a two-tiered variation on the mess we already have. Who is it? So let me pose to committee members. Please, Cheryl, you're the chair. I would appreciate it if you'd run this, not staff, not consultants. This isn't on them, it's on us. Where did this come from, colleagues?
If I can just respond since you called me out, what I recall is there was a chart with various options, and one option was not including Medicare, but it wasn't like a recommendation from Finance and Revenue Committee. That's not what I remember. So that's what I know.
It got presented
as a recommendation,
as a recommendation, as something we wanted to get feedback from the board about. So I'm sorry to be suspicious, but there's somebody who not only wants to do this, but they want to make it look like we want to do it.
I don't recall that as being a recommendation. I did miss the last committee meeting, so I don't know, if that was discussed at all, but I don't remember us putting this forward as a recommendation. It hasn't. I mean,
Morgan, I see your hand up. I'm not going to put you on the spot here, nor am I going to put Mimi on the spot.
I do have an answer.
As a member of the committee, I want to hear from my colleagues.
Yeah, Jeff has his hand up, and I would just say this was a bullet from our discussion that I think Jeff asked that I include as part of that conversation. But maybe Jeff, go ahead if I maybe misconstrued that when in putting together that in text.
Certainly. Yes, I did raise the question at the end of our last Finance and Revenue Committee meeting. And I raised it because given the scale of the number that we've now been able to generate, thanks to the good work done by a number of people, of the incremental taxes required to do a single payer universal health care, the question I was raising is this a route that we want to continue going down, given the scale of the additional taxes required to do it? That was the first part of it. And then the second part of it was, if the goal is to provide simply universal health care for everyone, given that we have approximately 3 to 5% of Oregonians who are not covered, can we get the other 3 to 5% people covered with funding and a level of care, which I did not define. I left that open, just with the level of care for the other 3 to 5%. And therefore we get to the universal health care, but not perhaps in the manner that has been asked of us to do. So this was, that was the core of the two questions that I was asking about it. And
let me
based upon all the work that's been done and the issues that have been raised.
I do recall that conversation. I think you've raised a number of good points during our meetings. You did raise the issue about looking at options in terms of benefit design, which is here. And I do recall many of your comments about Medicare and Medicaid and how difficult, if not impossible, this would be if we don't get Medicare and Medicaid waiver approvals. That would all be fair. But this language moves that to me to a much more fundamental we're going to continue the business of multiple tiered approaches to healthcare, two-tier plans. And one board member, I think, one of the flaws in the system here when you're watching a recording is you can't tell which board member unless you recognize their voice. I recognize Mary Lou's. I don't know other board members well enough to know who's talking. But I just want to say I don't want to have anything to do with any language that suggests we're going to depart from a single payer approach. That was the first issue we settled at the task force. And we made it clear, we're not coming back. 770 made it clear. We're talking about single payer plans. Now, I will share with you, I know from being involved in all the discussions when the bill funding this effort was in the legislature, that there's clearly a group of Democrats who would like to see this effort look at options other than single payer. And you could argue to the degree to which they were effective. In fact, I think that's what Governor Kotek was referring to in her letter when she said she knew there were differences between Democrats that before she signed the funding for this bill, she hoped they would resolve. Well, obviously, I feel very strongly, but I feel strongly that it's time for us to go to a formal process where any communications with the board from this committee are approved through a motion, second, discussion, vote process, that the slides for communication to the board, we have a chance to look at them before they're presented at the board. And we start a more formal process here. Cheryl, you choose who speaks.
Oh, well, I just want to say that seems reasonable to me. And I think that's a good recommendation. Charlie?
I essentially agree with John, although I will say that I can probably do a pretty quick calculation for the revenue part of this if we, for example, do not include Medicare. And I'm pretty sure it's going to come out that we're going to need about the same amount of revenue, because if we do not include Medicare, that means we're going to be paying that Medicare eligible patients would provide less reimbursement to providers. And so every other reimbursement will have to be greater in order to make providers whole. And it's going to require about the same amount of revenue, but I will make an attempt. I think I can do that modestly, quickly, as a rough estimate. And it's going to be about the same. So it's not going to save any money to do that.
Jeff?
Thank you. On the same topic of the communication going up and down and also side to side, I listened to much of the plan design meeting that happened in the last couple of weeks. I don't remember which day. And it's not entirely clear to me, and that may be entirely on me, that we are talking about the same plan design in terms of level of coverage between what we're proposing financing for versus what plan design is putting together. And I think it will be helpful for us and our colleague committee to know that we're looking at the same plan design as we are going forward. This may be on me that I'm dense enough so I didn't figure it out on the plan design committee, but from listening to their committee discussions, I could not tell that what they're talking about in terms of design and coverage is the same as what we're talking about.
I don't know, Mimi, if you wanted to speak to what Jeff just said. I used to be
Yeah.
in the plan design committee, but I haven't been at those meetings for a really long time. So you have certainly more updated information.
Absolutely. Yeah, if I may, Jeff. So I definitely appreciate your comments, and I agree we can always do better about informing all of the committees what's happening with one another. But I think as we've spoken about this is still an iterative process. Plan design and revenue has not made a final recommendation around again around all of their recommendations. You know, I added on their primary care payment model, which was approved through the committee and the board. But I think as all of us, we've been through this conversation several times, it's sort of a little bit chicken and egg. How much money do we need? Well, what kind of plan do we have? Well, what kind of plan can we have with the money? So I think that recognizing that for the most part, they have coalesced around that PEP plus level of benefits as mentioned. You know, they talked about that early on. However, there may be some changes. And I think that's why there is a lot of time set ahead in 2026, kind of the months of April, May, and June. I think there's still going to be a lot of revisions made. So I think that I definitely appreciate your point, and we'll keep working to do a better job of informing all the committees what everyone is doing. But I think that, as I said, it's an iterative process and there will be changes in it. So there is not much that right now that's completely finalized.
Just to follow up on that, I would go one step further. Simply informing the committees what the other committees are doing is necessary, but not sufficient. For example, if plan design is going down a particular road of the design for coverage for everyone, and we are going down a different road, I put you as an example only. I'm not advocating this. I use this as an example. If plan design is saying we don't want to cover mental health, and we're going down a road that says we're covering mental health, well, then somebody needs to take the lead at the governance level and say, hey, plan design or finance revenue, change the path you're going. That's what I'm not hearing. That's part of the iterative process today, not waiting until next year.
Thank you. And I'll just reply. I think that at the board level, when all of the committees do their updates, and I think that's a big part of the board meetings that happens, and then also the board chairs are kept updated on it. But I think more at the board level, that's where some of that synchronization. So I'll stop. But thank you for your comments, Jeff. I definitely agree, necessary but not sufficient.
I do want to add, though, Jeff and Mimi, that I know that in our original plan for this committee, the timeline, we were going to meet with plan design together in like June or July. We just weren't ready to do that yet. So I'd be very open to having a joint meeting with that committee. I think that makes sense to me.
Great.
We need to schedule it. And I'm sorry that kind of got sidelined as we were trying to figure out this revenue proposal, and all these things have been happening the last 2 months. But I do think we could schedule it, I don't know, maybe October or something. I think maybe is a good time. John, you have your hand up, but I'm going to call on Mary Lou first since you haven't spoken yet, and then we'll get back to you, John.
Okay, as everyone knows, I came into this whole process both on the board and the committee a year into whatever had been going on. And I had been kind of loosely paying attention, but not real specifically on these details. And I guess I was, when John was saying we needed some formal voting, whatever, I really hadn't really paid attention to kind of what the committee set up or how it was in terms of when we were discussing things and whether it was going to be a formal recommendation to the board or not. And it's been kind of loose and kind of like, okay, well, all right, well, we could take a look at other models or whatever, but I am totally committed to a single payer model. And how do we fund it? And how do we get it out there and have the benefits that cover everybody the same? We have such a mess with the current system. And so I guess, Jeff, back to your earlier comment about we have 3 to 5% that are not covered. I think that is a totally inadequate statement. We have, we don't know the number of people that are, yes, they don't carry an insurance card, those 3 to 5, but the insurance cards they do, other people carry are, vastly different and complex and make this whole system inefficient, ineffective, and just wrong. So anyway, if I somehow nodded my head at the wrong time or something, that was I was agreeing to, let's look at other possibilities. That really hasn't been what I meant to do. And since I don't have, like John said, we don't have a real formal process. I thought there were, people talk about notes. I guess I've never looked for notes. Whose notes are those? Are those individual? Cheryl is the chair, your notes, or Mimi's notes, or I guess we don't have real minutes and a real process. And I think we're getting down to the point where we're really coming to brass tacks. The other thing I want to say is when I did join the committee and I had an early discussion with the chair, Helen, about this whole issue of how can we at the finance committee be looking for the revenue that's adequate to cover the benefits that the benefits committee is coming up with. And Helen told me very directly that was not the original intent of this committee. And since I wasn't here, I didn't know. But she said the intent and the thing this committee is supposed to be doing is simply looking at how much revenue can we raise. And then that goes back, and it's not based on what benefits are going to be offered, which I had trouble understanding and buying into. But it was like how much revenue by various taxes and premiums and whatever we want to call them raise, and then what kind of benefits can we fit into that. I was going at it totally in my mind the other way around, that the benefits committee would figure out what are we offering, how much is that going to cost, and then we were supposed to be looking for how do we raise the money for that. So I think that's also something that's been unclear to me, and in terms of as the committee goes on, and I'm trying to be a member that adds value to the discussion. But anyway, I am totally for the fact that we need to have it clear before something does go. And then I am the only person, well, Cheryl and I, but Cheryl was unable to be at that last meeting, and you've also had some other conflicts this summer. So I feel like I've been the only kind of board person because Dr. Chi hasn't been attending. And then I kind of come there and am looked at and trying to be the one person to remember exactly, what we've said, et cetera. And these slides don't come out until practically the night before, a couple of days before. And then I'm kind of scratching my head thinking, did we really say that? So anyway, I'm concerned too.
Yeah, I just want to address a couple things, Mary Lou. First, I totally am with you on the kind of chicken and egg confusion between finance and revenue and plan benefits design. It's been that way and it is confusing. I agree with you. And that was one reason why we set up this meeting between the two committees when we got far enough down the road to kind of compare and see if we're on the same page. So I do feel like that will help.
Okay.
Secondly, I wanted to say that it sounds as though from the majority of the committee anyway, that we need to revise this statement on the approach. I haven't heard from Richard yet, so I'd really like him to chime in first, and I don't see Bethany. So, and I'm fine with that. The way I see this really is it's kind of like our revenue options. And I'll just give this example. This is how I view it. So we're coming up with this revenue plan, and we've got sales tax over here. Like this, we're showing it as an option, but we're not actually including it in our recommendations because we don't believe it will be politically viable, but it is shown as an option. That's the same way I see Medicare. Like that's not our recommendation to exclude Medicare, but this is what it would look like here. And in fact, with revenue options, we've got two other options, given HR1. So that's how I see it. I don't see it as a recommendation that we would pursue pursue excluding Medicare as a second recommendation, and I've never thought that. So I'm fine with changing that verbiage. I'm fine with formalizing the committee recommendations, or I suppose agreeing on how this is portrayed to the board. I mean, that's fine with me. So I just want to say, in terms of process, we can tighten that up. If we need minutes, that's fine. These haven't been my notes. I take my own notes, but I've relied on staff, which I actually very much appreciate. So so with that, I want to give it back to John and then Richard, so that we know if we're all on the same page here.
Richard, why don't you go first?
Okay.
I'm firmly committed to single payer plan, period. And I would not put the option of Medicare in or out in the same type of decision as sales tax in or out. I'm firmly committed to single payer plan. So for me, not having Medicare is not an option. In terms of the sales tax, Charlie and Morgan and Will have created a great spreadsheet, and we dial things back and forth as requirements change from plan benefits. But I think that we need to present both options to the group, because they have a dramatic effect on taxes, and I think taxes are still going to be hard sale. I mean, different kinds of, we have the premium, we have the income tax, we have the payroll tax, and we have the sales tax. So I think that we should firmly present both options, without sales and with sales, and have that discussion. Thank you.
Thanks, Richard, for clarification on that. John?
Yeah, well, so let me try and wrap this discussion up and then mention my second issue, which is relevant to some of the other conversations that have just occurred. So I'm willing to make a motion, but I don't need to, as long as I have the assurance from the chair, who will see to it that staff and consultants correct on the record of the board the misimpression that the presentation to the board might have given members, and clarify that this came from a member of the committee, but was not discussed in detail nor endorsed by the committee as a recommendation. And that the same kind of documentation should take place here on this slide going forward. That this was not a recommendation of the committee. So assuming that folks are all in agreement with that, I will go to my second concern. So after Morgan finished his presentation, and I believe after the break of the board meeting, there was then an informal discussion of members of the board, and Mary Lou was there. And during that more informal discussion, and near the end of it, the chair made a very emphatic statement. And her statement went along the lines of, it is the Finance and Revenue Committee's job to identify a politically feasible and equitable approach to revenue, identify that amount, and tell the benefit committee, this is what you've got to work with. I'd like to request that the committee get a copy of that statement in writing. And we preferably would have an opportunity to meet with the chair about how she would like us to determine what's politically feasible. Okay. You know, I earlier described, and I hesitated to bring up what I know was a politically really difficult process. Figuring out what's politically feasible here would mean that we would need to get the Democrats in both the House and Senate into the room and resolve the very significant differences that the governor hasn't been able to get them to resolve. I don't know, you know, we better get that $600,000 that we wasted in the last biennium back in order to hire a political consultant to figure out political feasibility.
So John, are you suggesting we ask the board chair to take out political feasibility from the charge for the Finance and Revenue Committee, that's not feasible?
How many times have we had a discussion about here's what the board wants the committee to do?
Mm-hmm.
The chair made this statement. She didn't ask other members of the board to endorse.
Mm-hmm.
She didn't make it as a motion. And you know, again, it was 10:30 at night and a blurry YouTube picture. But she was very emphatic about that. We need to figure out what the board and especially the chair expect us to do. I've never been in an organization where a finance committee had that kind of power. That we're basically going to make the financial decisions and then tell other committees, here's what you've got to work with. That's almost always what a board does. And by the way, I think I made comments to this effect. I was so pleased that in the last 3 months, with Charlie's help, with Morgan's help, with Mimi's help, we've developed a set of tools that should allow the board itself to make their choices in terms of all the variables we now know they'll have in order for them to make the decision about what resources go and where they go. You know, that I urge that we see that statement in writing, that be in the records of the board. And I think when you see that, I personally think we should have an in-person conversation with the chair of what are we doing wrong here? And what about political feasibility? What about equity? What do you expect us? You know, in the Oregon Health Policy Board, when it came to equity, to their credit, they turned those decisions over to a committee and all the resources necessary to organize the Health Equity Committee at OHA. And that committee did a superb job of equity. If she wants somebody to make a determination about health equity, maybe we should ask the committee chair of OHA's Health Equity Committee if they'd be willing to take you know, our proposal on. So, you know.
Yeah, I certainly think we need clarification and maybe maybe a change in how that was articulated, and maybe we need to understand the meaning behind that statement. So I agree with you on that count. I do want to, I know Charlie and Marilou have their hands up, but I do want to ask Mimi just a process question. Should we be voting on John's proposal in terms of changing this language to reflect what this committee wants, which is the recommendation on the single payer and not excluding Medicare? Do we need to do that more formally, like vote on it, or is knowing that the consensus of the committee is a recommendation that includes Medicare?
I think that it would be beneficial, and again, apologies for being off screen. I think it would be very beneficial to have what the specific recommendation in writing and voted upon. I don't think, because essentially, you know, what was said and what was on the slide was on the slides, but I think it is absolutely appropriate for the request to make a clarification statement and then everyone agree, and then, or whoever agrees, and then submit that. I think that will just be more clear than trying to rework things. But within that, of course, saying that it was not the recommendation of the committee,
So
if that is helpful.
So Mimi, so are you saying John should articulate his motion in writing, or can he say it and it's just
Oh,
recorded and then?
yeah, he could certainly say it, and
Uh-huh.
then you could have a vote. I think that would
Then
be
we could
completely
vote. Why
appropriate
don't-
as well, and would make it happen more quickly. Absolutely.
Yeah, I'd like to suggest we do that and take care of that. And then I think the second thing, John, that you mentioned in terms of the chair's statement, wanting that in writing, I would imagine that will be in the board minutes. I haven't seen those yet, but if they're not, it seems to me that we should meet with the board chair regardless to clarify her meaning and to make sure we are able to articulate that we don't believe that's feasible for us to consider political feasibility. So I don't think that needs to be a motion, but I believe we can make that meeting happen. We can address that. Or maybe she could even be at our second meeting this month or something like that. So John, would you mind restating your motion so that we can all vote and just do that in a formal way?
Okay, well, I would like to move that the committee communicate to the UHPGB board that the content related to no longer pursuing, not pursuing a single payer model and not providing coverage for the Medicare population was a concept discussed, but not recommended by the committee. And that the minutes of the board should reflect that going forward.
Okay. So first, all in favor, you can say aye or raise your hand.
Before we vote, I want to have a discussion on that.
Oh, okay, Charlie. Go
So,
ahead.
and again, before we vote, I really think it's important for us to have a rational, at least preliminary calculation of what the effect would be. And I think I can do that fairly quickly. And in fact, I think what it's going to show is that it's going to cost more to exclude Medicare. And I mean, the reason, why would it do that? I mean, I already said why it would probably cost at least as much, but it's going to cost more because that would continue Medicare Advantage, which is going to have a higher administrative cost than what a single payer plan would have. And it would also cost providers more because it would complicate things for them. And so I'm almost sure that we would find that it would cost more in taxes to exclude Medicare than it would to include it. And I think if we should provide that information along with an estimate of that, along with what John is proposing. And so I would, at this point, think we should wait until we can get some preliminary numbers for that calculation. Because I think it would also have a much stronger effect to say, okay, you could exclude Medicare and it's going to cost you more. It's going to cost more taxes.
And that,
So,
okay, and that analysis is fine, and that's a good argument, but the motion was specifically on correcting the record, that we didn't state that as a
okay.
recommendation. So
Okay.
I think that's
Yes.
fine. Mary Lou, go ahead.
No, I agree with that. And my hand had been up really prior to, so let's vote. And then I'm trying to, with all this discussion, I do remember what my point is. But anyway, let's
Okay.
get this process done.
Okay, how about we just do that vote and I'll get back to you, Mary Lou and
Okay.
Jeff. Okay, all right. So all in favor, can you raise your hands?
I'm sorry, Madam Chair. It needs a
Yes.
second. Somebody needs to second it.
Second,
Oh,
Oh, I'm sorry. Yeah, we haven't voted, so.
second,
Sorry, who seconded it?
Gibson.
Okay,
And
Richard.
then, and
Now,
Cheryl, could we just do a roll call? I think that'll make it easier
Okay,
than asking
fine.
people
That's
to raise
fine.
their
Go ahead.
hands. Thanks. Isabel,
Yeah.
do you mind?
Yep. Cheryl Ramirez,
yes,
Chenway Cheese absent, Mary Lou.
yes.
Thank you, Richard Gibson.
Yes.
Thank you, Jeff Goodman.
I'm going to vote no, because, and I want to explain why, if I might. This confusion and the discussion we're having this morning is predicated on not having good written information in front of us to see how we're going. We have, so permit me to suggest simply tabling this for the moment. Richard, we were meeting until noon. We got a break coming up. If you could craft something, or if Mimi or Isabel can put something in writing to bring back to us before this meeting is over, then I think we will be served better. But this feels like a rush to judgment. I'm not saying that's what is being what Richard has proposed is without merit. It is, but this has the feeling of just simply reacting to something without seeing something in writing to get it clarified. So I'll be voting no.
Okay, thanks.
Okay, John Santa.
Yes.
Thank you. Bethany is not here, and Charlie.
I'm going to have to agree with Jeff on this. I'm going to vote no.
Okay, I think that means that with 4 yeses, we would need 5 to pass it.
So motion fails. Okay, so we will, well, I guess I'll have to ask Mimi and Isabel, is that the suggestion that Jeff put on the table, is that something that we can do during this meeting? Just need to figure out a way forward here.
I would suggest that it might be more beneficial just in considering what we have on the agenda today and what we're hoping to accomplish, that if it's possible that if John Santa wouldn't mind putting that in writing, and then it can be formally voted upon at our next meeting.
Okay,
We've had a verbal.
Cheryl, if I could, Charlie, Jeff, my motion was meant to correct a misimpression at the board. It wasn't meant to make any statement about the worthiness of this language. It was characterized as a recommendation coming from this committee. And as I think everyone has agreed, the committee did not make a recommendation consistent with this language. So all I'm trying to do is
correct the record, right?
History is correct the record.
Yeah. That's what we were voting on.
You are more than welcome, especially, given Jeff's correct history that it was a concept that he brought up. We just did not have the kind of discussion and the data-driven discussion like you're asking to have time to do. All I'm asking for is to correct the record. I'm sorry, I learned when I worked for Governor Kitzhaber, never let an incorrect record survive. It will come back to haunt you. That's all I'm trying to do here.
So if I'm understanding now, you're basically saying to say that this did not, in fact, come as a recommendation from our committee.
Yes.
That's right.
I can change my vote on that then. And I think that would to a yes vote.
Okay, so that gets us to 5. Mary Lou?
Okay.
I'm sorry. Go ahead,
I
Jeff.
was simply going to.
I'll defer.
Okay, so good.
Sorry, but
Then my previous thing, Cheryl, can I speak to it? Okay.
wait, just wait 1 second. Jeff, did you have something more on the vote? I just want to make sure we have closure.
Yeah. As long as the clarification is very clear that this simply is correcting the record.
Yes.
Then I will then support it with. I'm still reluctant to do so, simply because of what I described.
Yes, understand, yeah.
But in this case, and given the narrowness of this, I will also then support it.
Okay, thank you, Jeff. All right, so motion passes. I think we've heard from everybody, so I don't need to ask for any notes. So, okay, thank you very much. Mary Lou?
Mine goes back to this issue of the words of political feasibility and what the role of this committee and ultimately the board that I sit on. I have said clearly to the chair and to others that I do not believe that is our job. As I understand, our job is to come up with the best plan possible from this erudite group of people and these committee, all the other committees and the board, and put that plan forward to the powers that be, to the legislative process, to, the political process, to you name it. And if we sit here and try to, I'm not saying that we, put something out that we all go, this is outlandish, we can't even support it. But I think that our job is to really go through this painful process that we're going through, looking at all these various options, listening to, people that listen in and later, say things, etc. But I think this issue of us being responsible to come up with, quote, something that's politically feasible, either from this committee and I'll argue when I'm speaking at the board, is not the charge that we were given by the legislature.
I agree with you, Mary Lou. That's how I see it as well. So I just want to say that.
Thank you. Good.
Okay, Charlie?
So related to political feasibility, one of the things that it seems like the board chair may be forgetting is that the amount of revenue, amount of taxes people are willing to pay will depend tremendously on how good the plan is. And so to say, first decide how much money you can raise and then figure out from there what you should cover, it's like, well, that's, again, it's backwards, or it doesn't recognize the interdependence. How much people are willing to pay is going to depend completely on how good they perceive the plan to be.
Yes.
Okay, Jeff, one more comment, and then I want to summarize where we're at so that we can move on. Jeff,
Certainly. Number one, I just want to say to all of my colleagues and all of us here in this committee that how much I appreciate that everyone has done everyone else the courtesy of candor, because we cannot have a good discussion without that. So I appreciate that very much. The issue on the political feasibility, I have been following in the papers, etc., online, the workings of our legislature with respect to this recent transportation effort. And I do not think that we can completely ignore the question of political feasibility in the analysis and the revenue plan that we do. I think that we hurt ourselves with respect to credibility if we send something up to the full governance board that will be shot out of the water immediately. Now, people can disagree on that, but I look at the challenge the legislature has in going through to get the transportation funding done, which I think people understand transportation more than they understand healthcare. But
I don't think so.
So I don't think it can be completely taken off the table. Thank you.
Cheryl?
Thanks, Jeff.
I can't find my hand thing, but I guess I would disagree, Jeff, that it's in the lap of the legislature on the transportation bill. I do not believe this is going to be in the lap of the legislature to decide that kind of tax. It will be their job to forward it to the people for a vote. That they're not going to have to, they have to put the plan forward, definitely. And I'm not saying it won't be huge discussions, etc. But in my mind, it's not exactly the same.
Okay, so I want to move us along now. So by summarizing what I believe the action items are. So we voted to correct the record, so that will move to the board. That will be corrected and moved back to the board. Charlie has volunteered to do a Medicare cost analysis. I don't want to speak for Echo Northwest. We'll let them talk for themselves if they're willing to do that or they feel like that's in their scope. And we will ask the board chair to join us at our next committee meeting to clarify her statement and to provide her feedback on how we believe the political feasibility is pretty impossible for our committee to do. And then let's see. And then we will also formalize our committee process more, and we will be voting on things. We'll be voting on how our discussions are articulated to the governing board. We'll vote on that language. And then of course there's the straw proposal. That is kind of a formal process, and we'll be working on that. And I believe, I don't know, Mimi, if you're going to show that today or not, but I don't remember if that's
No, not today. We'll wait till we get feedback or the input from today's meeting, and then we'll put it together and bring it to
okay.
so people can have time to look at it. Yeah, for the next.
Okay, was there anything I've missed in terms of next action steps?
This is Mary. This is
Cheryl?
Mary Lou again, and I'm sorry, but I'm going to leave the meeting and come back in. Somehow I've pressed something that tells me I'm in safe driving mode, so I can't see you, etc. So I'm going to go and come back in.
Okay, thanks for that. John?
Yeah, I feel strongly enough about this issue and clearing the air about it, the political feasibility and the chair's comments, that I would appreciate if there was an in-person option.
Oh, okay.
For those of us who are able and willing, I personally, assuming I'm in town that day, would go wherever was needed to make that an in-person. It always worries me that virtual sessions are limited in terms of the options to communicate well.
I agree. Well, we'll see. We'll count on Mimi to help us with that and see if we can make that happen. One other thing I forgot to say is an action item for follow-up is that we will work on convening this joint committee meeting too with plan design. I think that's really important, so we can see if we're on the same page. And I think, I mean, Mimi and Echo Northwest, correct me if I'm wrong, but I think October might be a good time for that.
Yeah, absolutely.
Okay.
We will work on it. Thank you.
Okay. So with that, let's move forward. I don't know, Mimi, if you finished all of your updates. I'll hand it back to you.
Not at all. Well, we did talk about the board talked about. I will be very, very brief. Just if people will take the opportunity to look at the attachments to this meeting, you will find that there is the primary care payment preliminary proposal that was put forth by the Plan Design and Expenditure Committee that was approved by the board. So you can take a look at that, and also the new committee member policy. I would appreciate that. And then just a few other updates. So that was from the board meeting. CECC has put forward a strategic messaging guide and a one-pager, some information that was approved by the Community Engagement and Communications Committee. Those items, which have been drafted and reviewed, will go to the board for final approval. So that will be coming along. Plan design and expenditure, you can see on the list there what are coming up on our next meeting, which is just this Thursday. And then same thing for operations, really, especially with Milliman coming on board, really diving into administrative operations, startup costs, and IT systems. So that's it for me. Thank you.
Thanks, Mimi. Any questions for Mimi before we move to Echo Northwest?
Yeah, I have a question. Yeah, just on the provider issue, which I was impressed with. again, based on the discussion we've had about the crucial role that administrative savings are playing in any financial estimate, no one would support primary care being reimbursed generously and better than now. But there's still going to be an expectation that they dramatically reduce administrative costs. So the statement that they get 15% of the budget is fine as long as they understand that the budget's probably going to be 15 to 20% less. And that will include getting rid of all of the administrative things that plague primary care. There was a comment in one of our public comments, or the commenter said they became aware of a committee of nurses and doctors who basically are overseeing coding by individual providers. We know there's 100,000 nurses involved in pre-authorization across the country. There's an army of financial people around the reimbursement systems. And, you know, I just hope however that's negotiated with primary care keeps in mind that if those administrative savings are threatened, our house of cards falls apart.
Agreed.
Thank you, John. And Jeff?
Oh, yes, thank you. If everybody has the opportunity, and I know we're all leading busy lives, the last design committee meeting had an excellent presentation from, I think it was Milliman, it might have been Eco Northwest. I apologize for not remembering which one, but they broke out those costs, the categories, into the categories of product development, promotion, marketing, and sales, all of which would disappear, info systems, servicing all of the patients and the clients, and financial management, and gave a very detailed and excellent discussion of those costs that would disappear and those costs that would remain in each of those 5 categories, providing healthcare coverage. Perhaps Mimi or Isabel, if you can find that particular link and send it out to all of us, it would benefit the discussion.
Absolutely. Thank you, John. That was the operations committee meeting. That they presented that. You know, thank you. We can do that. Thank you.
Thanks for the suggestion, Jeff. You just reminded me, Mimi, were we going to introduce Milliman today? Or not?
We don't have an official intro today. We were saving that for our next meeting.
All right, it just reminded when you mentioned Milliman. So, okay, so let's move forward then and hand it over to Echo Northwest. I bet that's Morgan.
I think it's Morgan and Will.
Okay.
Sorry, one of those, I lost my cursor and couldn't find it.
Terrible.
Well, let me go ahead and share, and I don't know why my mouse is being so finicky this morning. Okay. We all seeing the screen there?
Yes.
Great, thank you.
Yes.
So it's been a very quick 2 weeks with lots of things happening and the holiday. And so what I would think about today's presentation and discussion is really just a continuation of our meeting 2 weeks ago. And where we left it was, I think we kind of went through a lot of these kind of key questions around sort of economic efficiency and equity, kind of reflecting your principles. And what we tried to do for here was to try to take that conversation and try to just make it a little more concise, precise, so that we can advance this conversation around what we're trying to, for lack of a better term, calling a core proposal, right? Because knowing that there's been discussion around potentially moving forward an alternative one, maybe not an endorsed one, but for the board to consider. So, in taking all this here, I want to make sure that, just like, because I think as John has raised, language is important. Treat this very softly, right? This is our sort of understanding of kind of the conversation, but knowing that the conversation has some variance, but so call it like an average sort of understanding of these issues, but that we're trying to put it together so that you can have something to react to and provide better guidance. And so, what do we think is really kind of starting to emerge in your conversation, right? Is that there's a proposal that's really trying to provide enough revenue to provide universal single payer care at the sort of PEB plus level that would cover all Oregonians. And so with that, what we've kind of been talking about this sort of metaphor of, well, there's going to be sort of the core parts of this, right? There's actual coming transfers that are coming from businesses through a corporate income tax, corporate activity tax, through an employer payroll tax. And then we have transfers coming from individuals vis-a-vis the personal income tax and a personal premium made through personal income tax payments. Here, right, businesses continue to remain the essential sources of funding of the proposal, but much of the majority of the new funding is generated through progressive personal income tax and per person premiums that kick in at levels that you've been discussing. Sales tax, I think you have this on the side, but are retaining as something you continue want to study. So the core proposal really has those two key elements. You want to then supplement that what we've been calling kind of side dishes for a range of either policy or nexus determinations. So the lodging tax, right, is we still kind of don't know exactly what the number is, right? But you kind of identify conceptually that you want to be able to fund care for visitors as well as to cover administrative claim costs of people accessing the system who may be covered in other locations. You do want to target a range of sin taxes that are either currently levied or potentially could be levied. And this is really meant to offset the increased expenses of the cost of that care on the system. So whether through smoking, marijuana, alcohol use, or other things. So we're doing some other work here to look at sort of Washington, level sort of sin taxes like sugary beverages and other things as sort of things that we could sort of then supplement. But I think we can kind of leave that piece alone, just partly because we know that it is meaningful revenue, but not at the scale that we're talking about with the core proposal. So what do we think? If I think about the philosophy and trying to distill down what I've been hearing from members here is that you want to use the employer payroll tax and business taxes to replace those employer-sponsored insurance spending. So it's basically as a redirection of the existing private sector payments into a new public system, not necessarily a net new burden. So basically trying to say, how can we sort of take that money? And this is kind of what I've heard is expressing sort of the efficiency piece here is that we want businesses to continue to pay what into the system to replace it, but we don't want to necessarily put Oregon businesses at a disadvantage, perhaps. Okay, and so and then the primary source of new revenue collected is coming from the income, progressive tax, and progressive per person premiums. And so with the EPT, I think it's really important here is that while the EPT is formally paid by businesses, you are treating it as a tax expenditure. So basically, you're saying, hey, well, we created this new capacity in the system, but we really want to sort of use that to sort of redesign how we distribute that. And so you're going to use that to offset a personal income tax credit so that individuals aren't effectively taxed twice on the same income stream. And I think, I've heard sort of folks saying, I'm not quite sure I follow all of this, but yeah, thanks, Mary.
It's getting clearer.
But basically, so that there isn't sort of a weight placed on employment, right? Is the main idea here is not to create any distortion with respect to how employees are paid or hired, and so that Oregon continues to be an economically productive place to do business, and then the second piece right here on the PIT side is that the design here is trying to mimic the current cost sharing mechanism. So either payroll deductions for employer sponsored insurance or the Medicare premiums, but is trying to do this through a much more equitable income-based structure. Okay, so lower income households, right, are exempt or phased in slowly, right, ensuring that the overall plan is more progressive while still maintaining a broad base of participation. So I want to just stop here. Well, sorry, I have one more slide just to quickly summarize, right? So you're preserving the employer contributions in aggregate. You're trying to avoid sort of what we'll call kind of quote unquote leakage of money or dollars out of the state by administering the employer payroll tax because those EPT contributions are tax deductible on the federal corporate income tax filings. So businesses will find this much more efficient. It protects the workers from disproportionate tax burden through the tax credit. And then you're also trying to exempt a large majority of small businesses via a wage threshold phase-in. You're then trying to establish a very transparent individual level contributions tied to the ability to pay, not to a specific state of employment. So you're decoupling kind of, the ESI sort of structure that we have now. And then, right, you're trying to reinforce that, good healthcare is a public good, and so in the universality of that single payer system allows you to do that. So great. What I want to do is stop and just to say philosophically, am I missing anything or things that we want to sort of establish or on this? And I see Charlie's got his hand up.
Yeah, so the bullet number 4 exempts large majority of small businesses via wage thresholds. It's actually via the firm threshold. The wage threshold is for something else.
Yeah, sorry, I meant like aggregate. It should be aggregate payroll. Sorry, yeah. Thank you.
Yeah. I mean, and the way I labeled it was a firm threshold. So in the spreadsheet. And I would also say that the particular numbers that you chose, I'm going to talk a little bit more about that on some of them, but overall, I think we actually want employers to contribute a little bit less than they're contributing now, rather than a little bit more. The particular numbers you chose had them contributing just a little bit more, and I think we want to err on the side of a little bit less. So those are my general comments.
Right. We'll get into that second part, and thanks for the clarification on that correction there, Charlie. Go ahead, John.
Yeah. First of all, I want to say that this does meet with my expectations. I want to say that I really enjoyed and respected your presentation to the board. I learned at Consumer Reports that it takes a lot of work to figure out how to communicate complex issues like this. And you've definitely gotten a start in the right direction. Colleagues on the committee, the most, I think, impressive thing is that Morgan was able to handle questions. And from my sense, did a pretty good job of handling those questions. But, this is it's kind of like the word that's often used. This is the start of a dog and pony show. This is a stump speech. Morgan's got to get better at it. And somebody on the board's got to get really good at it and get better at it. And that process is starting. I was impressed at the board to hear that you're taking the comments that have been submitted to us, and I think the board by Ms. Krieger, seriously. Because we need feedback from people like her who questions a number of the assumptions we're making. And I think you said you were going to get in contact with her. You want to improve the dog and pony show and improve the proposal. You want that kind of feedback. So I think this is progress and significant progress. I would just reinforce what Charlie said. My sense also is at some point the board's going to want to be able to tell employers your contribution will be a bit to significantly less here, because just keep remembering that many of them are self-insured, large employers who don't have to do this. They won't have to do this. This will be a decision on their part because of ERISA. So I mean, colleagues, if you have a chance and haven't listened to Morgan's presentation, it's worth a listen in terms of testing yourself and all. So I see this as significant progress.
Thanks, John. And yes, actually, I had a chance to chat with Linda last Thursday, so it was good, and she had some really nice feedback, and we connected on a number of issues. All right, Mary Lou.
I guess I just say on the last dot point, reinforces public good nature. It's, to me, I think a word in there about kind of the economics of it. It is not just, social good. It really does make economic sense when you play it all the way out. And so I don't know where that can be reflected if it's public good. I don't know. Just I like it. You got it great, and I agree everything that John said. So anyway, that's my only thought, is that I keep telling people that it not only is a socially good thing, it makes economic sense going forward for our next generations.
So a healthy workforce is a strong workforce kind of idea, right, Mary Lou?
Yeah, right.
Right. John, I don't know if you got your hand up again or you got a separate comment.
I don't. I'm sorry.
Okay. No worries. Cheryl, I forgot before I started. I was trying to remind myself about the schedule and time check and when you want to.
Yeah, I was going to tell you that, Morgan. Since
Okay.
we started so late, I would just leave it up to you to put the break where it makes sense to you, like a good stopping point.
Okay. I think maybe we can kind of get through some of the conversation, and maybe right before we get to kind of like how do we take this conversation and get to a straw poll, we can maybe take a break and
that sounds good.
Have a meatier part of the conversation after the break. Okay.
Good.
Okay. So what I did was try to take that conversation that we had and start parameterizing it, right? Just not because I think it's where you want to land, but it's just trying to put a concept down here that's roughly in the right place so that we can talk about pros and cons. And I think Charlie kind of alluded to kind of like, well, you could put it here, but I'd actually argue we put it somewhere else. But I think I'm trying to do that so we can have that, part of the conversation in a place that's a little closer than what we had up last time. And so on that first part, right, in terms of firms, I had the corporate income tax and corporate activity tax, basically trying to raise the same amount of revenue. And so the tax bases are a little different there. And so the rates are a little different, but the output is fairly similar. And there may be reasons why you might want to go higher or lower, and we can get into some of those pieces. But that was the intent there. We had an idea. Let me get through this, Charlie. I see your hand up. The part of it here is well, there were some comments of we want the employer payroll tax to sort of match the current sort of ESI contributions. What would that rate look like? Particularly if we are targeting kind of a 100% sort of credit, and then to have a firm payroll threshold in the sort of 250 to 300K range. And so what I was trying to do is just kind of play around between the rate and the base to kind of get to that revenue piece, not necessarily as sort of any sort of strong inclination of kind of efficiency, but mostly is to try to just express some of these ideas, and we can kind of work off of that. So to me, like, this is kind of the core kind of working parameters here that I've just kind of put for discussion on the business side. So go ahead, Charlie.
So I think that the corporate activity tax should be very small. I think it's useful to have it a little bit, because it already exists and we can get a little bit of money from there. But because it's a tax that's going to be paid on gross receipts, and those firms that are not making a profit would still pay it, I think we want it to be really small. So that's my first comment. And I would, in general, I would say it should probably raise maybe a quarter as much as the corporate income tax. And I would also say the corporate income tax might even be a little bit too high of an increase as well. Although, and one other thing that you should put here as one of the parameters is the wage threshold, the individual wage threshold on which the taxes occur. And I think your choice of 140% is about right. I actually think it should be 138% just because that's where Medicaid is now, or maybe even smaller, so that there's a couple things going on with the interaction of this and the income tax. And I have to look a little more carefully. Somehow it seems the fact that the employer payroll tax is 11.7% and the income tax is only like 6.7, and there was not a fair amount extra raised by the employer payroll tax, suggests maybe there's a bug in there somewhere. I have to look a little bit more carefully. But to me, the fact that those are so different and it didn't raise more money is
Charlie,
interesting.
I was going to suggest that maybe you and I, Will and Richard, kind of sit down, because we were kind of with the last lot of revisions and trying to make some charts, right? We're just kind of discovering something like, oh, why didn't that move around? So I think
Right.
there's some things we just need to debug. But I think generally, things are working generally right for the conversation perspective, but we'll continue to clean that up for accuracy and precision.
Yeah, and so I would say that decreasing the CAT especially, but probably a little bit of decreasing the CIT, but maybe also decreasing that wage threshold to keep some money coming from employers. And so those are all things to play with. But the strongest comment is that CAT should be pretty small, if not zero. I kind of don't think it should be zero, but I think it should be pretty small.
Okay. Yeah, no, the gross receipts, and I think just for folks on the CAT, for those businesses that aren't paying the corporate income tax, they're taxed on a gross receipts basis, which generally most economists think is not that efficient, because you don't have any idea of how profitable they be. Think about it, it's like you could make $1 million as a small business, but be, in terms of total revenue, but then actually losing money, right? So you actually have losses that year, and you're still getting taxed on that. And so there's always this question of fairness and, like, is the tax kind of hurting small businesses? And so this is why generally people don't like the gross receipts taxes. And so, like, just for FYI, a little bit, Charlie, if that's right, in terms of why you're arguing on the CAT side of it, that makes sense, particularly since it's targeting a lot of those smaller businesses. But I think what you're also saying is lower the threshold a little bit to make the base a little bigger. So lower rate, bigger base on the CAT. Sound right? Oh, you're on mute. Oh, you're on mute, Charlie. No.
Right now, the CAT is on those companies that make more than $1 million in gross receipts, which I think is reasonable to keep. But just lowering it, I think, is useful. And so, and part of it with these numbers, employers are paying more than they're currently paying with our estimates, and we want them to pay less. So that might be sufficient to bring that down to paying less, is just lowering that CAT. So. But we can play a little bit more with the numbers. But that's my biggest point, is we should lower that CAT.
Okay.
For context, I think this is an 80% increase, isn't it? I think it's 0.5% right now.
Yeah.
Yeah. Pretty big.
It's 0.57 now, I think, is what it is. So yeah,
Yes.
roughly that.
Okay. Any other quick thoughts on the core business working parameters, just in terms of just feedback and thoughts? Okay, I'll move us along here. So on the personal income side, in order to kind of get to that, remember, we're still trying to solve for that fiscal year 22 around 18.4 billion number, right? Which is if you in fiscal year 2026, it's about 22, right, Will? And so here we have to end up with a personal income rate of about 6.5%. Because remember, we're crediting back the EPT. And so we're raising it more sort of equitably on the income tax side. We've set the conversation is to set the personal income tax exemption at about 140% federal poverty level to set. And then I think there was not much interest or discussion in having a hard cap, but continuing to sort of have a soft cap in here. So we then just reduced the soft cap phase in at about 50,000 in payments, and then set the marginal rate lower to 5% as that phases in. With that sort of in place, in order to solve for the personal premium and actually to get premiums at a level of contribution that is equivalent to what was being paid in 2022, you left with an average premium structure of about $52.50. And particularly if we're using a phase in at 200% of the federal poverty level. Go ahead, Mary Lou.
I guess my question, I've had some people ask me and I can't answer it, so I'm asking you to help me.
Yeah.
The numbers, Charlie and you, Morgan, 2022 and then 2026, I think, we've been talking about that this probably doesn't have really any place until 2030, maybe. And so why are we sticking with this 2026 number?
Charlie's got a great answer for that. Go ahead, Charlie.
Because, well, first of all, the 2022 number, because we have good data all around. And then the 2026, we have optimist estimates of moving it forward. And the further out we go, the more uncertain we are. So in my mind, I think we want to do a lot of work with just 2022 because we have real numbers there. And but at some point, yes, we're going to have to go forward. And these particular numbers, we have no idea if they will change or not, really. I mean, it just depends upon how the economy changes with respect to everything else. But I don't think there's much point in worrying about 2026 or 2030 at this point. I think we just stick with 2022 and see what we can do. And then unless we come up with a notion of why it would change drastically in the future, the relative amounts would change drastically in the future. So
yeah, I hear that. People are saying, well, come on, this isn't going to get implemented in 2026. There's no way. There's, all of this. And I'm going, heavens no. And I don't know where we say that or how we proclaim it somewhere so that we don't have everybody, arguing about things that really don't matter.
Yeah, Will, do you have a concise statement? I can give us a concise statement too. But
okay.
Go ahead, Will.
No, Morgan. No, why don't you go ahead? Actually, mine was more.
Yeah, I'll repeat. I think what Charlie's trying to say is the most important thing that the committee is working on right now is to try to understand the structural relationships around the efficiency and progressivity principles that you're doing. And to do that, we have really good 2022 data, and Charlie built the baseline model with 2022 data. So that's great. So let's be efficient perspective. So it serves this purpose of that you're trying to, from a principle perspective, to try to get the revenue in the right level to where the gap is. Previously, right, when we were doing our cost target, we will be able to use the optimist data to move it forward. So we would have a fiscal year 26. So we just have a general sense of like, if we were to implement this today, how much are we trying to get? Ultimately, right, we know that once we have the structural piece and then the plan design, we're going to try to have to sort of square that up in probably some fiscal year 2030 in terms of kind of what are we building it to. So I think the way I would sequence it is like, let's get the principal structure right. And then as the iterative process between plan design, operations, revenue, the board, that will then move all that analysis forward to fiscal year 30. Like, what is the proposal?
Thank you.
Right. Charlie, did I get about that all right?
yeah, I mean, I have some other comments if it's reasonable to give them now.
Yeah, go for it.
So in general, I think that this sort of straw proposal is a little heavier on personal premium and a little bit lighter on the personal income tax than I would. My gut would say feels right, but I need to look at that again, as you said, in more detail with with some of the graphs that I put in recently. I think so. In general, that's my feeling is there's too much from personal premium and not enough from the income tax. And the other piece.
Do you want to say what the issue is there, Charlie? I think
it just
important distinction.
So the premium is raising more money at the top end based upon having a bigger family, and I think that should happen, but I think it happens a little bit too much with the numbers chosen here, and that. Yes, more in your family when you're wealthy enough should cost more, but a little bit more should just come because of income. So actually, that's just my gut feeling.
Okay.
Another gut feeling is that I think that the soft cap threshold is a little higher than I would like, and the soft cap marginal rate is a little bit higher relative to the personal income tax rate than I would like. So those are just general comments, but again, those are all sort of playing with the details that I think everybody should look at a little bit more. So. And I also say that one of the things that I added recently, I think it's I'm not sure if it's in this spreadsheet that's available to everybody, but is looking at all of the AGI levels and the number of exemption levels, the details for that, for the tax rate and the total amount raised and the other amount raised. And to me, those are going to be interesting numbers for somebody who is sort of playing with the relative nature of the personal income tax and the personal premium. So
we have a little bit in there. Thanks, Charlie. And Charlie, Charlie's been messing around and adding things as these questions come up, and we've been trying to do it. We've actually turned it into a little bit of a scenario tester. So for folks, one of the things we want to do give out to people is the updated one where you can actually just kind of toggle. You can make like up to 10 different scenarios and just flip back between different ones to see how different pieces as some of these sort of key kind of policy questions continue to come up, so you can kind of see the effect of those pieces. I don't know, Will, do you have something specific here, or do you still have your hand up? Sorry.
Yeah, I'm struggling a little bit. Forgive me if I'm overstepping my bounds. Obviously I'm not a member of the committee. I'm just thinking apropos what Charlie said, and I am 100% in agreement with how you characterize the exercise here in response to Mary Lou's question. We need to understand the structure first before we move forward to 2006 or 2030. 2026 or 2030. There's just one element of this as we start to really nail things down, ratchet things down, and then think about how to make this more actionable. And that's just the, we'll see that, one of the coming action items for us to work on involves the reserves and the transition costs, which are not here, of course. This is filling the annual gap. I just have some concerns about how we're going to think about changes in the cost structure, and whether or not this this plan that we initiate is going to be adaptable enough to accommodate changes on the cost side going forward. And one very small instance of that perhaps is, I wonder, did we on the personal premiums, the per dollar amount, are we indexing that to inflation or something, or the cost of service delivery or something of that nature?
Right now, I think it's fairly static. Yeah,
I think it has to be indexed to inflation. Yeah, I think all of these numbers that we're putting in for 2022, I think have to be indexed to inflation. Yes.
I assume that's the case. I just want to, yeah.
Yeah, no, I think, Will, I think that's a good question. I think for everybody to keep in the back of their mind as this iterative process starts to speed up a little bit around the structure and the change of the structure we have here relative to the cost structure that are going to be moving forward on plan design. In particular, I think things that have come up at the board level, right, around cost containment and how does that get handled and such. Go ahead, John.
Yeah, this is more from a presentation point of view. Whenever the word tax is used, you need to say state. So the soft cap threshold is a total state tax paid, correct?
Yeah, correct. So I'll be really clear here. What we're talking about is just Oregon state taxes, not local taxes, not federal taxes. In the fiscal federalism world, the U.S., the state, counties, locals, we're just talking about the state. So thank you for that pointing out, John.
But eventually you're going to be talking less and less.
Well, everybody knows it's just your state, but yes, I think we'll make sure to clarify that, and so we're speaking increasingly to a much more public audience.
I mean, and in fact, I can envision a quote tax version where on some of these you would identify, okay, the 6.5%, it can be deducted on your federal tax return, or it can't be deducted on your federal tax return. Issues of that sort. because this does really raise some very complex tax questions. Just a a presentation concern.
Okay. Right. Thank you, John. Charlie? Will, I think your hand's still up.
So I think another thing that we should be thinking about pretty soon here, and maybe now is the time. In my mind, so the numbers, the revenue to be raised number that we're going off of is sort of a not unoptimistic number from Optimus that it doesn't take into account what the new big bill does to Medicaid, but it also doesn't allow for us to get some of the savings in the system that will come because of provider savings. And so I actually think that we should probably estimate higher provider savings and thus less necessary revenue at this point, just because otherwise I think we're going to, well, it's going to be harder to sell politically, for one thing, if we do not say, yeah, we're actually going to save more than what the task force allowed to be there. And we kind of have to push for that. I think we need to be pushing for the administrative savings. So I think maybe now is the time we do that.
Mary Lou, go ahead, and then I think Mimi, do you need to jump in?
If you don't mind, just if I could, I just wanted to point out, and we haven't had an opportunity to completely roll this out to this committee, but the work that Milliman will be doing, certainly around sort of revising the status quo, using 2023 data is the plan. And in addition, definitely working on those administrative savings. So I totally appreciate your point, Charlie. And just to know that sort of more precise data is coming along and will be, is everything that comes to other committees will come here as well. Thank you.
All right, go ahead, Mary Lou.
I guess that I kind of maybe sound like I'm contradicting some of my earlier statements about political feasibility here. But one of the things that, as I've been talking to people, wondering about, when we get ready for our language, it's almost like there's two levels of premium payment, maybe, in terms of people being used to the idea that you pay premiums for, that's what we call what we pay for our insurance level. But it's collected through the personal income tax system. And so I kind of, I'm almost thinking about, premium level 1 and premium level 2, that really is the increase in the tax, the same numbers, but just kind of that it's, people seem to be, and I hate to go back to what we talked about earlier, and Jeff, I've been following very closely too, all of the transportation stuff. And, this tax is, is just kind of more negative than I think it's been in my lifetime even. So anyway, it's just kind of like going forward, thinking about how do we present this, and it definitely is, income based, and that's how you pay, but you're going to pay on your income tax form. But anyway, just the language I'm thinking, because at first I was, if you go back to the record, I was opposing the idea of premium because I thought it confused people. But more people than I've talked to have been saying, no, people are used to the idea for insurance, that it is a premium. And so, anyway, I don't know if that makes any sense at all.
Yeah, it does. Thank you. Thank you. And so in the sort of vein of sort of trying to make sure we're being clear here, and I don't want to belabor this too much, I think people are understanding here, but just for publicly, is what is being paid by businesses and how you're shaping up the evolution of your proposal is turning that into a credit, right? So so just to be clear here, that the payroll tax, right, is generating nominally around 9 billion. About 0.5 of that still continues to go to the UHP net of the credit, but but that remainder that you have credited back to individuals, right? So you give to households, right? You still have then raised that 8.5 billion within the personal income tax system, right? And then we have the additional taxes filling that in. So just conceptually, right? If I think about it, for folks who think about it much more linearly, right, is that you've got the the employer payroll tax generating 9 billion. You give 8.5 of that back through two individual tax filers on their tax return. Because that credit is reducing net revenue, right? You must make it up through other sources, and you're doing that through some combination of the personal income tax and the premium. And we can talk, and Charlie has flagged kind of like how you might want to think about the relative contributions of those two pieces. But why are you doing that is the question, right? That seems like a lot of work, right? And potentially some brain damage. But the credit enables a system to maintain a more progressive structure, right, than would be possible if you're just doing it through personal income tax rates alone and targeting the net burden. So think of it on one hand that you had, well, why don't we just continue to put all that money from the employer payroll tax, they just pay the 8.5, and then we just have 8.5 billion that has to be raised less through personal income taxes and premiums, right? That's the most obvious sort of question. And the reason thus far that the proposal shaken you don't do that is because you can't, even a system where you're doing that with just rates alone, you can't get a system that has a more progressive structure to it. And that's still an option, right? You can have a less progressive structure that just relies more, but you raise these issues, and I think Charlie should jump in here as Richard, why that might be the case. Go ahead, Richard. Or Charlie first and then Richard, sorry.
I mean, so another thing that comes up is one of the things we want to try to avoid to the extent we can is pushing entities to organize in a way that doesn't make sense to them other than because of our tax structure. And so if you did not have this credit, there'd be business who would say, well, I guess I don't want employees, and I'm just going to do it as a pass-through business rather than having employees. Or and there's other ways of organizing that you could influence by having a tax that did not have that 100% credit. So I think in order to avoid there's many different ways that businesses can organize, and we don't want to push them one way or the other. We want to say our tax shouldn't help make your decision one way or the other. So I'll stop there.
Yeah, go ahead, Richard.
The last box says that it would be that the proposed structure would be more progressive than personal income tax, which is already progressive. But then the next part you go on and say based on income rather than flat employer payments. So we got three things that I'm talking about is how is it more progressive than that based on personal income tax, which is already progressive? And then the other thing is that I expected to be in that box but didn't see was the personal premium, which is also progressive but in a different way. So
I was already cramming a lot of stuff in there, but Richard, I think you're right in all those pieces. Go ahead, Rick. Go ahead, John.
Again, I'm kind of looking at this from a presentation point of view. I brought this up before. I'm just assuming as a Medicare person, all of my Medicare premiums are going to be paid. My B, C, and D premiums are going to be paid. Are they?
By the person.
paid by what?
No, by the plan.
By the plan? I thought you'd argued the other way.
You're paying premiums for people under 65. The task force assumed that folks would have to pay their Part B premiums themselves. I haven't gotten clarity on where UHPGB is with that.
Go ahead, Charlie.
So the numbers that are in this spreadsheet are assuming that people will continue paying their premiums. And
Medicare people.
The Medicare people would continue paying their premiums. And the one of the reasons for that, so early on, I was a proponent of the plan paying that. But when thinking about the fact that Social Security income is not taxable, that would make it, I think that changes the nature of things so that it would be really unfair if you if the plan did pay those premiums and did not tax Social Security. I mean, that just is to me a huge unfairness. And so because of that constitutional provision that Social Security cannot be taxed, I think we need to have people continue to pay their Medicare premiums, except for those whom the state Medicaid currently does. And so the that, I guess, benefit of those who are for those who are dually eligible would, in my mind, have to continue, and the numbers assume that that would also continue, so that those who have their premiums paid by Medicaid now would continue to have that, and those who do not would continue to pay those premiums. That's what the numbers assume, and to me, that's what fairness would suggest we should do. But we could change the numbers, and I could be dissuaded maybe against that, but that's what currently happens.
Yeah, and Charlie, I'm fine. I actually could go either way, but you better start explaining that as you kind of deal with the term premiums. Well, our take on premiums applies to everybody but Medicare folks. They're still going to need to pay their premiums.
Yes.
Essentially,
all of the thing we're talking about relate to state taxes, and which is, we maybe don't say that every time, but that is the case. Everything we're doing here is with state taxes. It affects nothing of federal taxes except for potential deductibility kind of things. So yes, so yeah, we probably should be a little bit clearer. You're right.
Yeah, and I can guarantee you the presenter better be able to respond to a Medicare person who says, wait a minute, I'm going to be paying more taxes and I still have to pay my premiums. But my son and daughter, who are working people, they don't have to pay premiums any longer, or they pay them directly to the state. You're going to have to, go through that rationale. And I think on paper, at some point, you need to say something, differentiate that.
Cheryl, what I would recommend, maybe we take our break now, and then we can pick up the bulk of that conversation. I think we'll get to a lot of the questions as we kind of move through some of the charts.
Sure, let's take a break. Could we just get back at, I don't know, 11? Is that okay?
Yeah.
All right, 11 it is. Thank you. Clock? Let's get started. Thanks, Morgan.
All right. Great. So let me go on to the next slide here. We're not reiterating here, but this is just what we've been talking about. On the left-hand side, more graphically shown, is the amount raised relative to the tax expenditure that has been created that has to be made up through some combination of the income tax or personal premium. I'm just kind of loading it up here on the income tax side for graphical ease, but one could think about sort of spreading that amongst both. In both what I'm showing here, as well as sort of the current in 2022 relative to the proposal, is sort of the change in sort of personal premium contributions in aggregate. So you see we got roughly, and this is inclusive of all premiums paid here. So this is just just to kind of help sort of graphically sort of break down sort of that 18.4 and where it's being raised and how we're treating the EPT collection and credit. So we kind of touched on this a little bit, but sort of overall, right, the system results in a net savings, and this is in line with sort of the design in the joint task force here of roughly $637 million, while reallocating responsibility between sort of businesses, individuals, and hopefully is more sort of transparent and stable than the current status quo system. And so you've seen this chart, so we tried to break it up into kind of two different pieces here for clarity's sake. And so you see the contributions that are coming from what we're showing in both the status quo as well as sort of this sort of, we'll call it sort of propose, at least my sort of like version of sort of for discussion purposes of a proposed revenue plan around how the sort of contributions in 2022 in that status quo would look in this sort of plan. And so what you see is in sort of the total aggregate payments there on the left. And then in the right is sort of the net differences. I think last time we were just showing the net differences and folks asked to see kind of both. And so what we're showing here, so you can see sort of the nominal amount and sort of the relative amount. Charlie had a comment here that I think we probably want to just spend a little time talking about. And Charlie, you talked about initially your comment of wanting to see employers perhaps or pay a little less than what we have here and to move the burden or the sort of distribution of those payments around a little bit. You want to talk a little bit about that point in a little more detail? And you're on mute there. Oh, yeah.
Yeah. I mean, basically just that I think we need to have each segment saving a little bit in our expectation. I mean, again, who knows what's really going to happen when we project forward, but our expectation should be that each segment saves a little, including employers. And so there's a couple of things going on here that maybe deserve comment. One, so if the employers save a little bit more, that means individuals will save a little bit less. But I also made the comment that I think we should say we're going to project that providers will actually get paid a little bit more or less because we're going to assume that they're going to have more administrative savings than what the task force assumed. The task force basically assumed 4% administrative savings, and the task force was well aware that projections were that they'd probably have 8 to 12% administrative savings, but they thought that some providers need to be paid more, in particular for behavioral and mental health and for primary care providers. And I think that's probably true, but I think we want to be a little bit more aggressive on the assumed provider office administrative savings so that everybody can save a little bit more. Now, we haven't really talked about administrative savings very much. Maybe we'll get more information to allow that conversation to occur more reasonably. The other piece is that the expectation, well, right now, governments, especially state and local governments, pay more of their, I guess, employer compensation in healthcare as a percentage of total compensation than do private employers. And therefore, there's a fair amount of savings from both state and local and also federal employers in projected by just doing this payroll tax. I'm not quite sure if we want to do anything about that. I mean, it's nice that they're going to have this savings, but it might also be nice to have a little bit less of that savings and have more from individuals because these are taxes we already collect. And the federal government is like, well, we don't care if they have savings, sort of, we don't care. But I don't know what we can do about the federal government piece, but the state and local, maybe we can do something about that, but I don't really have a good idea at this point what we could do about that. So anyway, I'll stop there.
All right. No, thanks, Charlie. Those are all fantastic points. Cheryl, go ahead.
I agree that it would be hard to swallow to see for private employers to see that their contribution is going up. And I understand these are aggregate numbers and there are private employers who don't participate in insurance right now. But as a small private employer myself, it's hard for me to fathom paying actually more than I already do because it's a lot. It's very expensive.
All right. Thank you, Cheryl. Richard.
Can you please go back to slide 13, I believe it is, 2 slides back?
Yeah.
Yes, this one. So when we talk about changes in personal premiums, are you being specific on premiums or is it premiums plus cost sharing, meaning total out of pocket for families, individuals and families?
Yeah, and help me out here, Charlie. So this goes back to, and Will too, I think, and I don't want to get it wrong here. What we're using this is the total contributions in 2022 from individuals. That's inclusive of premium, some out-of-pocket expense as well.
It's actually includes essentially premiums and all out-of-pocket expense, except for those out-of-pocket expenses that we expect will continue to be out-of-pocket expenses for individuals. And that's primarily the other well, so it's medical supplies that people sort of buy on their own right now and will probably continue to buy on their own. So that's about maybe 20% of out-of-pocket expenditures now. And we expect that will continue. And we don't intend to have the plan cover those sorts of things. But they're part of national health expenditure accounts. And so, but yes, essentially all out-of-pocket expenditures and premiums are what both of those things, and they contribute roughly equally to the current expenditures, a little bit more from premiums than from out-of-pocket, but not much. But
So I would adjust that to say premiums plus cost sharing, where cost sharing is deductibles, co-pays, and co-insurance.
I think you
well, and it's more than that, because it also out-of-pocket also includes what those who are uninsured pay. So so it is whatever individuals pay, and I don't actually know the numbers on that, but a substantial amount comes from those who are uninsured, and they just pay out of pocket.
Okay.
Thanks, Charlie. John. Oh, what happened there?
Again, from a presentation point of view, I like that first slide. Go to the next slide. This one, I think the observer will be attracted to those public employers, federal. I've been involved in lots of discussions about the degree to which, well, could savings at the state, I mean, if this is cheaper than, if you will, PEB, couldn't that be shifted over to the universal health plan? The responses I've all gotten is, well, good luck with that. And if you ask, well, I look at my property tax, and the school district is going to save a significant amount of money. I look at this, and as a Medicare person, I'd say, well, can I expect some savings? Can I expect my property tax to go down 4 or 5% as a result of this? And of course, the answer is, well, good luck with that. And so this is an issue, and even the federal government, I would guess the federal government at this point would say, well, we'll list this as an option for federal employees in Oregon, but we're not going to, list it as the only option. And so they'll be a very interesting employer to deal with. So I think that slide is effective in terms of bringing this issue into play.
Thanks, John. Great. So, so that was kind of talking about sort of our aggregate payments, and one of the things I think we want to flip to here is explicit discussions on sort of progressivity or the equity principles that you have. And so with the tax credit and by the use of the premium here, you're able to make the structure, depending on how you want to do it, fairly progressive, right? So new contributions rise pretty sharply with income. And so particularly with sort of minimal increases for households under 80,000 and then accelerating. So what you see here in the chart is the net amount raised by each AGI category. So we're showing here is in millions on the left, where high income households, right, are bearing the sort of largest sort of new contributions. So you have some dips that really have to do with sort of the exemptions and the phase-in processes, right? But broadly speaking, right, this approach, right, is shifting kind of the sort of, we'll call it more flat or non sort of employment sort of flat premium or income-based, employment-based funding for healthcare to more income-based contributions, right? That aligning the cost of the universal health plan with ability to pay from a principal perspective. Go ahead, Cheryl.
I don't know about everybody else, but I'm seeing your presenter view, so the slides have become small.
Yeah, sorry. I realized that the charger at the table I was at was actually not working. My computer was dying, so I needed to move. But is that better? Or do we?
Yes, that's back to the
Go
presentation.
to the right slide, though.
Oh, okay. Whoops. Hold on just a sec here. Everything disappeared from my screen. Hold on. Let's see what's going on. What is going on here? Sorry, here. Live. When I plugged into a new system, it didn't carry over. Hold on.
There we go.
Okay. All right. Now are we seeing the right one?
Yes.
It's
Okay.
the presenter view,
It's
though.
presenter view. Okay. How about now?
Yes, now it's the presentation.
Yeah,
Okay.
but we're not seeing the whole slide. There's
Yeah, I don't know
That's the
what
problem.
is going. Okay, well we'll just go here.
Okay, all
That
right.
looks
Slide this off to the right, and we'll go this
Yeah,
way.
that looks better. At least it's
Okay,
big.
and we can live with this. I'm not sure what's happening on the tech side. All right, sorry. Go ahead, Charlie.
So I would say this has a little bit. It has something to do with progressivity, but it's a combination of how progressive it is and how many people are in that AGI category because it's total amount raised. So it's in useful information, but probably doesn't really show
The
progressive
next slide,
nature.
we'll get into some of these a little
Yeah,
more.
right. And so the dips really have more to do with how many people happen to be in that category rather than anything else. So yeah.
Okay, go ahead, Mary Lou.
That was my question, was kind of all of a sudden what happens at that 200 to 250. It looks like all of a sudden they're getting a break. But now that Charlie explained that, so I don't think that's the best slide for presentation.
I think this is mostly showing where is the money coming from of that sort of.
Yeah, that was
being
I
raised.
put that in for my own benefit to kind of know, but I don't think it's useful for a presentation.
I don't think so.
I thought it was pretty useful, Charlie. Thanks, but
Okay, yeah,
yeah.
You have to
People
do a
want
lot
to
of
know,
explaining.
where is it coming? But yeah, it's the nominal amount relative, the aggregate nominal amount relative to the rep distribution of it from a more progressive perspective. And so this chart here, I think, gets into sort of the sort of percentage point. So this is showing not as a percent of tax, basically not as a percent of AGI, but is showing the relative increases amongst those. So basically, what are you paying now in your premium structure, right? Relative to the combined part of this as a percent of your sort of total payments. So basically, think of it as basically how much more would I be paying in total, right? Relative to the kind of current status quo.
So no, it's actually what's the percentage of your AGI that you're going to be paying in new taxes? And I should point out that the reason that there are some that low income are paying more is because among tax filers in Oregon that have zero there are quite a few at low income with zero exemptions, and so they are actually under the way that the tax structure is designed, they would be paying new taxes because they are filing for a family that has other people in it, and they're dependent on those other people. So it's not that there's a tax on those low income people, really. It's a tax on, or not as a family, there is a tax on those low income people because they're choosing to file even though there's no exemptions in there. So federal poverty level is 0 for them, I guess, is another way to say it. Another chart, and I don't know if you're going to include this thing that I presented, was the same thing by AGI category and number of exemptions, so you could see that information as well. Okay.
Yeah.
There. Okay, great.
Yeah,
Thank you.
I just went to 1, 3, 5, and 7 just for clarity, make the point around sort of how it changes by Charlie's got it all the way through 8, and there's, I think this issue around kind of 0 exemptions a little weird, but I think this helps demonstrate this sort of the principle around the taxation relative to the number of exemptions claimed by AGI. Go ahead, John.
Yeah, can you return to the previous slide? Yeah, again, I look at this slide, and from a Medicare person point of view, I'm scratching my head going, now wait a minute. I'm paying my premiums. I'm still paying my premiums. So where are Medicare folks? If you took them out of this analysis and created a curve just for them, gave them credit for they are paying their premiums, how does it work for them? You follow me?
Yeah, I do. And I think we have this a little later in the slides. One of the things we wanted to do is actually to do that, right? I think part of it here is we've had such short turnaround between meetings. To implement that is a bigger lift. But I think one of the things we want to, and we'll get to commit to, is actually to kind of be more explicit about that. And I'll just say I've been listening to John, and I was like, oh, we got to make sure we sort of deal with the sort of the Medicare piece, because it's important, and 2, we need to be a little clear. But we've been kind of trading off a little bit of like the timeliness here and the nature of the discussion, as opposed to kind of getting to the fuller treatment and diving down with a little more precision. So go ahead, Richard.
Yeah, 2 things. I'm looking forward to building the personal calculator, where we'll take each of these socio-demographic groups and be able to talk through that. And that'll be good reflection back on the work we've done here, and then we can fine tune it. So I think it will come out that way, and I'll look for that. The second thing is, on this slide, if people have concerns that we're taxing people at low incomes, I would say that net, and we'll get to it under the personal calculator, we're saving them from some premium exposure and some cost sharing exposure. So if someone looks at this and said, you're not protecting people at lower incomes, let's wait till we get to that calculator, because I think that we will be protecting them from out of pocket that they won't face on a universal health plan. Thank you.
Go ahead, Charlie.
So related to John's question, I haven't been able to find data that would say how much of the income of those who are eligible for Medicare is in Social Security and how much is other. So it's going to be a little bit hard to do what he wants, but we can maybe make a sort of an attempt and some estimates of like, well, if you're in this AGI bracket and you're on Medicare, what is the likelihood? We can maybe guess at how much of it's Social Security. So we might be able to sort of do that, but it's not going to be, it's going to at best just sort of give you a picture, I think, rather than a
I think that's
something
right. I think it'd be more illustrative under a certain set of conditions without knowing kind of precisely what the actual distribution looks like.
And I'll also say that again, the tax for low income people that is apparent there is all due. It's not just some due, it's all due to 0 exemption people, because nobody would be paying a tax if they have any exemptions at all in those income brackets. And so I think we want to keep that in mind, that it is really just an artifact of the 0 exemption group.
Yep. Go ahead, John. And Michelle, I'll just say, I see Fritz has his hand up, but during the meetings, we only take discussion from committee members. but there is a period of time for public comment. Okay. Thank you,
Oh,
Fritz.
Fritz,
I realize there's
Milliman.
Oh, was that? Oh, sorry. My God. So it's early on a Tuesday morning after a long weekend. Sorry, Fritz.
A little loud.
I
Go ahead, John.
realize,
John, and then Fritz will have something to say real quick, but go ahead, John.
yeah, I realize, Charlie, this may be difficult, but I think we should try. And the other issue is, should Medicare folks be removed from this analysis? Are they making it look better or worse when their situation is different? So, I mean, I'm just making suggestions here, and I see Charlie's response. Thank you, Charlie.
Maybe I'll just respond quickly. Is the data that I have, and maybe the Legislative Revenue Office has more,
Yes.
but the data that I have does not allow us to know the fraction of people in each AGI category that are Medicare eligible. So we don't have age data along with the detailed revenue data. So it's actually not possible. The other part we can kind of do, but the removing the Medicare people, I don't think is possible. So.
Oh, go ahead, Fritz.
Hi there, everybody. Thank you for taking my call. I don't know that I've been, maybe I have. There's been a lot of meetings, but just in case you're not aware, my name is Fritz Bush. We are your other vendor, working primarily on the plan design and expenditures for the project, a couple other things as well, and working with Morgan and Mimi and their team to pull all that together. I just had a question on there was, I believe it, now I don't recall who said it, may have been John, who made the point about the low income and that they will be, so their taxation there is going up, somewhere around 1%, but they will be saved, some out of pocket spending, particularly things like, if they are subject to deductibles or co-insurance. And then of course there's other things that they buy that are could be covered under the universal plan, such as over-the-counter things and things like that. So I have a question, I think, and but then it's also a statement. Is as we go about the plan design and expenditure piece of this, we do have data, and we will do a lot of imputation to get healthcare costs by income brackets. I doubt we will have the detail here. I think the tax data is quite a bit different than the claims data. But there will be ways to sort of impute that. But my question is there, and I apologize because we've just joined, just more recently than all these meetings have been going on. So is there a contemplation here of not just making the revenue piece of this progressive, but also the cost sharing piece of it? So for example,
No.
there is not. Is that, and I don't know who said that.
Mary Lou, I just blurted. I'm sorry.
Okay.
I mean, the intent is there is no cost sharing. So
yeah.
So that's the current intent. And to the extent that there would be cost sharing, I mean, I'm not quite sure where that would be contemplated, but really at this point, our assumption is there's no cost sharing.
Correct.
Okay. And the reason I bring it up is because at this point, I totally understand that. But it could be that once everything is valued, that the price tag, the gap is just too wide, or it's too wide, wider than you would like, and that is an area that obviously you can lower the gap by reducing the expenditure. So that was always, I'm just trying to think ahead a little bit in terms of what that looks like when we do our expenditures. We will have the data by income level, just not quite as precise as that. So I just want to raise that now.
All right. Thanks, Fritz.
Mm-hmm.
Sorry for not remembering. All right. So I want to kind of move us along here quickly. So I think what we said here, right, this chart, and I think it's one of the last ones we have, is right showing kind of how how the effective universal health plan tax rate changes across AGI with a number of exemptions. So basically, right, said explicitly for folks, this is a proxy for household size. And so households with more exemptions or more members, right, generally face lower effective rates at the same income level due to the broader exemption and phase-in of the premiums. And so this highlights a little bit how how this proposed structure, right, is trying to account for family size and trying to improve sort of equity, affordability, and particularly larger households in that sort of middle income range. I think it's when Charlie added this, I think this is a great piece. So you can kind of see, right, we've been talking about it more from an aggregate AGI level, but within that, right, you care about household structure and the number of individuals there. And so, what is happening at each band and how does by doing it in the pit here with the tax credit for the EPT allow you to kind of do this with the phase in by income. So any other last thoughts here? Charlie, anything else you want to kind of note there? I think that was a very nice ad. Appreciate that.
Well, one of the things to note is that it does go up pretty high at high incomes, and that is for large families, and that's basically due to the premium. And so the premium part is what's making that have a pretty large increase at high incomes, which I think is reasonable, but that's part of what made me think it's maybe a little bit too much, but just a little bit. So anyway, I'll stop there.
Great. So I'm gonna stop here really quick because I think what we've done here was, right, we've been iterative, evolving, taking your feedback, trying to be a little more precise around the parameters and why. But Mimi or Cheryl, I think we're trying to now pivot to sort of, I would call it more of a procedural sort of decision-making process here to try to get to something we're calling a straw proposal. And do you want to just maybe say a few words about why we're trying to kind of get to at least some initial clarity that can be shared more broadly, and kind of why we're introducing kind of this, at this point, I know there's still things that people are moving forward to, but I think it's worth kind of pausing and saying that.
I don't know if Mimi wants to chime in because she's been working on it, but the whole point of a straw proposal is to kind of test if the governing board is supportive. And so if you remember, there was this process loop where the committees submit a straw proposal to the board and they provide feedback. They may vote to support it, or they may ask us to do some more work. And so that's the point of a straw proposal. I just want to mention here that it's looking like, well, correct me if I'm wrong, Morgan or Mimi, but it looks like we're going to need a second meeting this month. And if we can get the straw proposal really well drafted, then that means the straw proposal would go to the October board meeting. We wouldn't have time to submit it for the September, I think it's the September 18th board meeting. So just want to mention that. Mimi, did you want to add anything in terms of that process?
No, I think that's exactly right. And just sort of as John Santa was talking about having things really being codified and in writing, this is absolutely the time where this happens. Having said that, of course, it is still a proposal, and recognizing that it will still be in slightly broader strokes than what will eventually come back. So this is the time for the board to weigh in on it. But the closer that you all can get to your recommendations to the board, and maybe some of it will be within a range or some will be absolutes. I think that will also give the board something to react to. So thank you.
Yeah. So thank you, Cheryl. Thank you, Mimi. And so with that said, I think from a process piece, I think, I've heard from Charlie and Richard on really sort of, I think in the most specific terms of kind of, well, we should probably, try to rebalance the aggregate contributions in this way and target, broadening the base or lowering the rates in specific taxes on the business side, as well as sort of maybe rebalancing some of the contributions between the personal income tax and the premium side, as well as sort of maybe playing with some of the more equity and progressivity measures around phase-ins and whether it be at the soft cap side or at the oh, sorry, at the soft cap side. So I guess I will kind of like step back. If we kind of make some of those changes, and I haven't heard any strong precision with outside of those two individuals, or the sort of those potentially the current ones and then the refined ones that Charlie may suggest, directionally acceptable as a starting point for us to start nailing down. And then if not, right, what would you like to see changed? Are there any strong sort of specific alternative scenarios, right, that you would like modeled, right? So this is really about big pieces, right? Big partial credit, no soft cap, perhaps a lower premium and higher pay. I mean, we talked about that a little marginally, but are there kind of, I'm trying to think of basically what's going to give anybody heartburn without kind of making sort of marginal changes to what we see here, right? To kind of improve some of these things that you guys have talked about. So I want to just kind of pause a little bit, just kind of make sure that we nobody's having strong sort of want to have any pushback or see something different than the sort of course that you guys have been on here. I just want to make sure we have that time to chat about that. Go ahead, John.
Well, first of all, in general, I'm very comfortable with this proposal. I'm comfortable with the variables that are being used now, but I would anticipate that the board would look at some of those, and if we've done this right, they will ask for variations in those, and they will get skilled in looking at the tool themselves, or at least a subset of them will. And certainly the tweaks that I've heard Charlie and Richard mention, that's fine with me to go forward. This is a straw proposal, so I'm okay with it. Again, the one element I've mentioned in the past that I think could help a bit would be to have a specific Medicare payroll tax that essentially, and now that there's someone here from the actuarial side, to look at the value of the benefits that Oregon would be providing to Medicare folks, the PEB plus benefit package versus the Medicare package, and what's the value of that, and figure out a Oregon Medicare tax to pay for that additional benefit that folks will get when they turn 65. And so it would be a small number on a lot of people, collected over many years, which is one of the beauties of Medicare. I don't want to stop the process for that. I would just like to keep, I'm not prepared to take it off the radar screen.
Okay. Thank you, John. Go, Charlie. And then Mary.
So one of the main benefits, I think, for Medicare population is actually not better benefits. I mean, there is a little bit of that, but the biggest benefit is that they will be more likely to be able to find a provider, because providers will be paid as much when they see that patient as they are for private insurance now. And that's going to be hard to quantify. I mean, it would be worthwhile trying to quantify that if possible, but that, in my mind, is the biggest benefit for Medicare patients.
Well, I agree, Charlie, but based on the task force, the dental benefit in Medicare is a big piece.
Mm-hmm.
I think it was approaching $1 billion. And Medicare folks would welcome that. And it would be an incredible public health benefit. But, I agree with you. I think the fact that there would be more freedom to move around in terms of providers, and that the payment would be the same. I suspect most Medicare patients don't realize how different Medicare payment is than commercial, et cetera. But the benefit, like dental and to some degree vision and a few other things, it's $1 billion, I bet.
Mary Lou, and then I think Fritz has probably some answer there.
Okay, I just have some general feeling about the straw proposal and how it's put together and who puts it together and how much time the committee has to really think about it and work on it, because the other straw proposals that have come forward to the board, I felt came very quickly. It looked to me like, I don't know who wrote the 4 or 5 pages of whatever. There wasn't much time. I think that you guys are giving a lot more credit to this board, and I'm a member of it, okay? And I feel like sometimes I'm a weak link on it, but I don't expect they're going to dive into this like you're thinking. You know, they're going to go, oh, okay, well, a little bit of this or that, and the next thing you know, we've got only 15 minutes. We need to get this straw proposal voted on. Let's do it, and it just happens. And so I'm just a little nervous about, I mean, I think the level and the depth of what's being talked about and presented on the finance stuff is really here at this level. And I do not expect to hear maybe 1 or 2 board members that'll ask any kind of difficult questions. So I'm sorry, but that's how I feel.
Thank you, Mary Lou. Jeff, Fritz, do you want to do a quick just answer, and then I think
I'll just answer the question about the Medicare benefits and the Medicare payments. So our analysis will have an estimate on the difference in the benefits, the covered benefits, including the dental, for commercial and med. So under and over 65, we'll also have an estimate on the difference in payment in terms of a percent of Medicare.
Thanks, Fritz. Go ahead, Jeff, and then Cheryl.
Completely agree with Mary's comments, based on my observations of the overall governing board's meetings.
All right, Cheryl.
Well, I would say for something as critical to the plan as the revenue proposal, we're going to need more discussion, and I think even to have Morgan help us present the proposal would be a good idea, so we can really dive deeply into the straw proposal. It's more than just a 15-minute discussion on the board. So I would agree that we need more time and more details on this one for sure at the board meeting.
And the board has some time to think about it ahead of time and be
Yes,
encouraged to do more than nod their head.
Right. Mm-hmm.
These are just some more specific ones that nothing we need to sort of deal with here in the remaining time. So Cheryl and Mimi, I'm just thinking of process here and the timing. And excuse me for thinking out loud. Sorry, thinking out loud. Thinking out loud, yes. So one thing we could do here is if the committee was fine with it, is do some, and I think because we wanted to do some of this offline anyways with Charlie and Richard, since they've been so heavily involved in a lot of the just obviously in Charlie, right, with all the work, is maybe we could if both of those two would be willing to kind of work with Will and I to kind of put together that proposal. That way we can have something written out that the committee could take a look at the next meeting, and then we could spend some time and then do some and do the polling there. That seems to me like a pretty efficient way to get there, because I think we're close, but I think some of the sort of pros and cons of what Charlie and Richard had articulated might just kind of need a little back and forth. Like, what if we did this? Well, does that really kind of capture what the committee wants to do? But I think Charlie and Richard kind of working more with the broader committee hats as opposed to their own ones, and helping kind of get something together. If they're good with that, I think that might be just really efficient.
Yeah, I think that's a wonderful idea if Charlie and Richard are willing and available to.
Thumbs up.
Yes.
Perfect. Then I would also just say, when it comes to, I think, just thinking about John's point, I'm happy to kind of help put this together and do the play-by-play, but having a representative from the committee, either Charlie, Richard, or John, also maybe we'll call co-present and do a little more color commentary to my play-by-play, do the John Madden to the Al Michaels thing. I know Mimi doesn't like sports references, but
I don't either, but that's fine with me.
I would say if folks are okay with that, I think that also might be a great way to kind of carry forward a lot of the issues that or the issues that John had raised earlier. So,
Yeah.
This is Mary Lou, one more time.
Yeah.
Cheryl, I don't know whether you can recommend their Mimi or whatever, but honestly, okay, if it's going to be on the October meeting, I would certainly love to see that meeting in person. This is a very important part of what that board needs to really go through. And, you know, most of the time, I think all the time, I've been in the room except for once. And I tell you, it is very hard for the members in that meeting to, there's technical issues go on, people, I can't get this done. It just, I don't like for that board meeting on really important topics to have it be partially this and that,
Yeah, I agree with you, Mary Lou. I had a terrible technology
connection. I
problem
know.
come up at the last board meeting. So I certainly plan to be in person, and I don't know if that's possible for Morgan, maybe more possible for Charlie and Richard. But,
yeah, or whoever. But I just the board members too, to be really encouraged to be in person if that's what we're really going to. I mean, it's kind of, to me, the two big things are, what are we going to pay for? What do the benefits look like? And how are we going to pay for it?
Exactly. Agree.
Okay, thank you.
Go ahead, John.
Yeah, this discussion reminds me a bit of how many times in healthcare have we said, oh, remember the days when nobody cared about this or that issue? Believe me, there's going to be a point at which this gets sent to the hospital association. There's an incredible a group in Washington, D.C. that focuses only on ERISA issues on behalf of employers. They're going to get this. They're going to see this. There's going to be a lot of very sophisticated large employers who are going to look at this, including the PEB board. So very quickly after any board discussion, if we think about it, we want to be sitting down with those people and getting feedback from them. And believe me, they will look at it all over the place. They'll give Charlie a run for his money. We do need to be prepared for a very sophisticated analysis of this to be done in multiple quarters.
Yeah, go ahead, Mimi.
Oh, sorry. I was just going to remind the chair that we do have some members or some people of the public who would like to give public comment. And we're getting pretty close to time. Thanks, guys.
Well, I would say just looking ahead, we don't need to get into every one of these specific things, but I think we're keeping a track of lots of different moving pieces, right? So we're particularly focused in on trying to get the structure of the revenue proposal correct, but I think there are a variety of other things that with respect to sort of the legal analysis of that proposal, the coordination, right, and with Milliman, as well as sort of, I think, as Will articulated, also we have to find ways to once costs for on the transition and startup have been identified, as well as sort of thinking about the reserves. Those are also sort of downstream issues we're going to talk about, and I think everybody wants to know, right, is like, how does this affect me, right, pre-post? And so we'll be, working with both the board and communications to try to get that together at a point in time that it makes sense. And so that's still sort of TBD. With that, Mimi, I think we have enough. Charlie, Richard, Will, and I will reach out after the meeting to kind of find some availability this week with you, and we can get started on that.
Yep. That sounds great.
Thanks, Morgan. So I just want to say really quick, we don't really have time for meeting reflections and all of that, but it sounds like we will have the supplementary meeting in September this month. And we'll keep working on this draft proposal. Hopefully we'll get it fairly well drafted. Maybe we'll do the Milliman intro too, Mimi. Will we do that in September? Yeah, okay. Yeah, so look for a draft agenda and some information in between so we can be prepared. So with that, let's move to public comment, and I'll hand that over to Isabel.
Thank you. Yes, so as always, we really appreciate members of the public offering public comment. Written public comment can be submitted at any time via our website, and we ask that people submit those 72 hours in advance of a meeting to be included in the meeting materials. And spoken public comment people can sign up 24 hours in advance of the meeting. And today we have two people sharing public comment, Lou and Linda, and I will go to Lou first.
Yep. Hi. Pleasure to see you all again. You're doing a good, a hell of a good job. I must say, I'm enjoying John's comments about Medicare and the need to really put this together. Medicare people tend to vote more so than any other group, I believe. So we really need to keep that in mind. The idea of a calculator is it's really necessary. I was at a Lions meeting not long ago. We had a presenter there from HCAO, and this, Lions are relatively well off. And all of a sudden, out of the crowd came this shout, well, this is double tax, right? My only, I didn't know how to respond except to say, now just hold on here, wait till we put the plan together and you'll have a calculator. Knowing now, like a lot of people, when they get that calculator, they won't include all their out-of-pockets and whatnot that they go through. They won't include a lot of those details. But I think the double tax thing is really a worrisome thing and has to be solved. Are they going to keep paying? And then on that income above Social Security, are they going to be taxed on that? So let's think about that. Thank you, John, for your comments on that. Being on Medicare Advantage plan, I certainly understand where you're coming from. So thank you, group. You're doing a great job. And I'll see you in the future.
Thank you, Lou. And Linda, I wanted to give you the opportunity to share comment today.
Can you all see and hear me?
Yes.
Okay. Thanks for the opportunity to do this, Chair Ramirez and committee members. I did submit written comments and they have been posted, so I hope you've had a chance to read those. There were two items in my posted written comments. One was an argument against the 100% personal income tax credit. And I still feel pretty strongly about that, and I hope you'll read that, but I don't want to really spend time of my 2 minutes talking about that today. The second item was about misleading aspect of a couple of the slides that were presented at the board meeting, and I think those have been addressed. So today I'd like to talk about two other things. One, very important, the individual wage threshold concept for the payroll tax. I'm concerned about the Walmarts of the world taking advantage of that if their individual people aren't paid very much, but they're, overall they're paying hundreds of thousands in payroll, that they will end up not having to pay that tax if we put a individual wage threshold on the payroll tax. So that's very concerning to me. The second is on the personal premium. Today, people are more used to paying three basic tiered rates: individual, couple, and family. Not, I have 5 kids, so it's 5 times $5,000. No, it's individuals 5,000, a couple is 7,000, and a family's 10,000. I'm just throwing numbers out there. So I think we need to think about that calculation in terms of the individual, what we're calling premiums, which will actually be based on or part of the income tax collection. Thank you.
There weren't any other public comments, Isabel, just the two. Okay, all right.
Thank you.
Well, thank you, and look for homework in your emails, and appreciate the discussions today. And we'll see you in a couple of weeks for our supplementary meeting. So we'll be adjourned now.
Take care.
Bye.
Thanks, everyone.